Very much, Governor Mutua, my good friend for many years and from a long time. I just want first to thank God for allowing us to be here at this time. I want to thank you and your team for a very warm welcome to Machakos County. And on behalf of the team that I've got here, I want to say jambo to watu wa Machakos. Mwaseo ringi. Asanteni sana. Leo nimesema badala ya kutubia watu kutoka Nairobi, tufanye kutoka Machakos, na tutaendelea hivyo hivyo kutembelea kaunti zingine, ndio watu wajue kwamba hii virusi si virusi ya Nairobi, ni virusi ya Kenya nzima. Na vile vile tumefurahia sana kufika hapa Machakos, kwa sababu tunajua Machakos ni kaunti ya maendeleo. Tumeona mengi, wameendelea vizuri sana. Hospitali tumeona ni safi sana, na Ministry of Health. And this is what we want, the standards that we have noticed here in Machakos all around. Standards of hygiene, standards of cleanliness, standards of behavior. Sisi tumefurahia sana hiyo maneno. We are very happy, and I want to congratulate all the health workers in Machakos County. Namshukuru. We are very pleased as a Ministry of Health and as a government. We are very, very pleased with what we are seeing here in Machakos in terms of general health care, but also in containment of COVID-19. So, fellow Kenyans, some 52 people have tested positive for COVID-19. This now brings the total to 1,161 persons who now tested positive. The cumulative tests so far are at a high of 55,074. In terms of the spread, Nairobi has a higher number this time with 23, Mombasa with 7, Busia with 7, and I would like to urge the government of Busia County to become extra vigilant and extra careful.
About 200 beds for isolation, 122 are spread out in other various health facilities. We have about 12 beds in Kenania, that's Mavoko sub-county, about 16 beds in Kangundo, and 12 beds in Machakos Level 5. The Machakos Level 5 center is picked as the critical care isolation center. The other beds are spread out in other various health facilities in the other 9 sub-counties. At the stadium here, we have a capacity of about, the space can take up about 400 beds, but currently in this particular dome tent, we have about 100 beds and a few beds at the holding area in the screening area. So basically, this is a facility that is supposed to take the extra patients in case the situation gets out of hand and we get so many patients in our health facilities, we'll be able to take care of our patients. The ward currently can hold female patients, pediatric patients, and male patients, and we have beds, we have monitors, oxygen concentrators, heaters to warm the place because at night it can get a bit cold, and we have facilities, ablution facilities within the stadia for the female patients and male patients, and the staff also have a lounge area, a place where they can get their meals, and a place where they can take their baths after work.
Just my last question, give us in terms of figures, how many confirmed cases of COVID-19 do we have so far? How many are in quarantine facilities here in Machakos County?
Okay, thank you very much. For COVID positive cases, we only have 2 patients. One patient is the patient who traveled from Kilifi, Tanzania, Mombasa, who ended up in Kathiani sub-county. The other one is a truck driver who tested positive at the Malaba border, but this is his home county. They are both being nursed at the Kenania facility in Mavoko sub-county. They've been asymptomatic, so they are stable, so we are just taking care of them as usual, and our staff are being quarantined at a hotel in Mulolongo. For quarantine, we have about 24 cases, 2 of which were reported by the public having traveled from Changamwe and Mombasa. We actually received one today who traveled from Changamwe and was reported in Masinga. The other 21, where 8 are female and the others are male, were sold mangoes to a lorry driver who turned positive in Taita Taveta. So the mangoes were sold from Mwala sub-county. So our surveillance officers managed to contact trace, and they are currently being held at the KMTC quarantine facility.
Okay, thank you so much. Thank you so much. We'll still be here in Machakos County. And remember that today the health CAS will be able to issue his daily briefing from Machakos Level 5 Hospital here in Machakos County. And therefore, we'll be there to bring you up to speed with on what will transpire today as far as COVID-19 status in the country is concerned. For now, I'm taking you back to studio.